Hi, everyone, and welcome to a special Trendy Tuesday live with Dr. Sophia Yen. So, today we have a guest speaker, Lauren, who is CEO and co founder of the Safely app. So, today, Lauren and Dr. Yen will be answering your questions on sex, STDs, and babies. My name is Nina, and I am a social media associate for Pandia Health, and I'll be moderating today's discussion. So before we head into the live, we have some special deals for you guys that you definitely need to check out. We have a code safely that you should use with Pandia Health to get $5 off your online doctor's consult, and use the same code safely for $10 off your STD panel with safely.me. Now let's get started. So, Lauren, can you tell us a little bit about the Safely app and how it's different from other similar telemedicine apps?
Yes, absolutely. So Safely is the only app that lets you show your verified STD status on your phone and or share it no matter where you were last tested. That's a really important piece. So there's two flows to it, right? Either you were already tested, doesn't matter where, your gyno, doctor, clinic, lab, for free. You can import that status. It's all verified directly from your electronic health record, so there's no faking it. Or you can also get tested. So if you need to get tested, you can skip the doctor's visit, the waiting room, the awkward talk, and use the app to book an appointment. There's 30,000 labs across the country, and you can use your insurance, in which case it's covered. Just pay your copay. Or if you don't have insurance or you don't want to use it, it's only $99 for the full panel. So cheapest option on the market.
Wow, so you really offer like a broad line of services in your app. So after this live, how can people find your company?
Yes, so you can download it on the App Store and on Google Play. Just search Safely app or Safely STD, or if you find us on the website, it's www.safely.me. So me, myself, and I.
Great. So now I think we should get started with some of the juicy questions that we have from Google. And maybe I just wanted to get it out there that this is an open discussion, and you should both just feel free to, add anything that you would like to add. So, Dr. Yen, what are the names of the most common STDs? And Lauren, if you want to step in, like which STDs can safely test for?
So the number one sexually transmitted infection in terms of people having it is HPV. So that's the human papillomavirus, and it causes warts on the outside, and on the inside it can cause cervical cancer, and then on the outside it can also cause penile cancer. And the reason why it isn't known is because there isn't any good commercially available test to test it on men. Generally, to test it on men, you have to sign up for a research study, sandpaper their private part, and send it off to a lab. But we do have HPV tests for women, and it's actually an opportunity to decrease your need for pap smears, because if you have an HPV test, then you can not have as frequent pap smears as they used to make us do in the past. We used to have to do it every single year, and then if you got 3 normals, then you could go to every greater frequency. But now with the HPV tests, we can decrease the frequency of pap smears that women have to have. Then the top two, the number one other disease is that, aside from HPV, because people don't test for that, and we can't test for that in males or those with penises, is chlamydia. And then after that would come gonorrhea. Herpes is also out there in terms of its prevalence, because you also have to separate herpes 1 from herpes 2. Herpes 1 is generally of the mouth, and herpes 2 is down in the private area. However, with oral sex becoming highly prevalent now, you can definitely put herpes 1 onto your private area. And so in general, they don't recommend screening for herpes type 1 or 2 unless you have an ulcer or symptom. But I like to screen for both to tell people, if you're going to do oral sex and you have herpes 1, then you better put something on whatever you're oral sexing. Otherwise, you risk giving herpes type 1 to that person.
You would definitely want to avoid that. Let's not spread. Want to contain it. And Lauren, if you wanted to touch upon which STDs safely can test for?
Yeah, absolutely. So we currently offer a 6 test panel, and we'll also be expanding it. So syphilis, gonorrhea, chlamydia, HIV, Hep C currently, and then the one that's optional for the reasons that Dr. Yen explained is HSV2. We don't currently test for HSV1. About 80% or more of the population does have HSV1. As Dr. Yen said, it's a challenging one because correct, more and more we're seeing instances of HSV1 that can spread to the genitals. When it does, it is generally, and I say generally, so always take these with some not grains of salt, but know that it's a generalization. Generally, fewer outbreaks and less severe outbreaks. But that does happen. HSV2 has historically been really the one that's known as genital herpes, but we like to give people the option of getting tested for it if you want to know. So a pop-up will happen, and we'll explain that in the app as well, but we do make it an option. One thing to note with the HSV2 test as well is it's an antibody test. And this is something I think with COVID happening, it's something we all are hearing a lot more about is antibodies and what does that mean? So it's really similar. It's tested for the antibody. So as your body either produce a reaction, it doesn't mean if you test positive for the antibody that you have ever had an outbreak or that you will ever have an outbreak. So herpes is spread during the time that it's viral shedding. But I will also caveat that particularly for women, but across the board, you can have viral shedding and not necessarily know you're having an outbreak. So we like to give you the tools so that you can know. If you test negative, then your most nuclear. If you test positive, it's not a reason to freak out. A large percentage of people are successfully managing HSV1 and or 2. And one thing that I want to tack onto this that's important to note is all STDs are treatable. Most are curable. And so the ones that are curable, and we can get into this more, but you want to get on that. And the ones that are treatable, notably the one that people sometimes come to us and maybe freak out about is the HSVs. Not a reason to. It's very, very effective treatments, but you do want to keep that viral so that you can, give people the choice that wasn't given to you and avoid passing it on unnecessarily.
But I really think it's important to distinguish between the viral ones that you are saying treatable versus when people think treatable, they think gone. And with herpes and with HIV, it is not gone. It is your friend for life. And if you aren't on medications, then you're very likely to pass it on to someone. So I wouldn't take HIV lightly. I wouldn't take herpes lightly. And most people are not on herpes treatment that have herpes. And actually, it's not medically indicated unless you have 5 recurrences within 1 year. So if you have herpes, I think you need to take it upon yourself not to spread it and know that it is a lifelong disease. So if you have herpes and you're positive, you should use something every time, or I think it's an assault on the other person. If you give them a disease, if you have sex with them, knowing that you have herpes and you didn't use any protection or you didn't give them a heads up. And in fact, there are websites for people who are HSV2 positive to hook up with other HSV2 positive so you don't feel guilty because you both already got it.
Well, I think a lot of this we say our mission is to end the spread and stigma of STIs. And I think it's really important to do both. It's very important to reduce the spread. This is very much within our control. But this becomes possible when we do destigmatize it as well. So understanding that, giving people tools to have the conversation with their partner, giving people the option, but also educating people on what these things mean so they can make the decisions that's best for them.
This is so important, especially like for young girls like me. Myself and my friends, we haven't been taught the tools, as you were mentioning, to talk about these things. Like it's very, you want to keep it very private. You're embarrassed about it, and that's why I think it's so important to address it and be open about it. So I totally agree, definitely.
Yeah. So the other thing, talking about antibodies that I don't think it was clearly pointed out that I think is critical, particularly for HIV, is that you can have a false negative. for 6 weeks after you get the disease. And so it takes 6 weeks for your body to make the antibody. So you could have HIV and you could pass HIV, but the test is negative. So I always say, just because someone shows you that, oh, I'm negative for gonorrhea, chlamydia, and HIV, unless you've been with that person with HIV 24/7 since the time they had the test, then 6 weeks ago, then you don't know if that person has HIV. And so I would absolutely just assume everyone has every STI or STD under the sun, because unless you've been with that person 24/7 for the past 6 weeks, which you might have if you've been quarantined in COVID and they haven't had to go anywhere for groceries, or disappeared sometime during the evening or anything like that, then you cannot be sure that they don't have HIV. And then I'm not sure, I wasn't paying 100% attention. Does the Safely app test for HPV?
We do not currently, because of how the test is done. We are adding the badge for the vaccine. So particularly because testing difficult, impossible in men, etc. So we want to incentivize, or try to incentivize transparency, but also positive sexual health practices. And each infection is different. With HPV, so we're adding a badge that lets you signify that you have had the vaccine. You should get the vaccine as well. It's now available both in men and women. They recommend an age, but so that's a recommendation. It may indicate whether or not your insurance pays for it. If you're above that age, which keeps going up, I think it's up to 35 now, get it anyway, because it can save your life.
Absolutely. There's a bunch of old folks' homes, or older people, or if you're divorced, but mainly there was an outbreak of I think gonorrhea in an old folks' home, but particularly if you're divorced and you're getting back on the market again, then you want to be protected against HPV. And then the key with HPV vaccine is to realize it only covers 9 out of 160 HPV. So just because you got the vaccine doesn't mean you are immune to HPV. You are only immune to the 9 ones that they put in there. And there may be some cross reactivity that protects you, but there are no guarantees. And actually, a lot of people in the beginning, physicians, not me, were against the HPV vaccine because they're like, well, it'll kill the ones that we know, but then what about the other 150? There's going to grow back and smack people down. And so the medical community is united on this, is get your HPV vaccine. But again, know that it only covers 9 out of 160 versions. So just because you have the HPV vaccine doesn't mean you're home free. And then I also say, as a physician, you could bring in your significant other. I could examine his penis and I'd be like, I don't think there's any HPV. But we only call it when we see it, because as I mentioned, there's no commercially available test to test it on those with penises. And then you go have sex with that, and then a couple weeks later, warts. Oops, I'm sorry, I guess he had HPV. So again, hear it from the physician. Just assume everyone has every sexually transmitted infection under the sun and use a condom every single time, unless you know that they are 100% virgin, never been sexually assaulted in their life, and you've been with them 24/7 for the past 6 weeks.
Is that so? Using a condom, is that the only way to fight the 151 other HPVs?
And even then, HPV is skin to skin. So the condom, as you know, only covers the penis. It doesn't cover the base where it's all furry and you're rubbing up against each other. Though I think the odds of getting it on this rubbing up furry part is much lower than the penis part. The penis part, the mucous membrane on the mucous membrane, and the chafing of the vagina, because it is a very abrasive situation for the woman, is where those viruses enter, those micro kind of punctures into the vaginal walls.
So if we look at STDs that actually have symptoms like vaginal itching, what are the STDs? Which STDs should we be aware of that give vaginal itching?
So many STDs can cause vaginal itching, but which includes syphilis, gonorrhea, trick, but it's important to note that the majority of times, women in particular do not have any symptoms for STIs, especially no initial symptoms. So, and also related, you can absolutely have vaginal itching from things that are not STIs. most common being from BV, bacterial vaginosis, and yeast infections, or myriad other things. So that's why to understand whether you are positive for an STD, you must get tested. What's important is that while you may not have any symptoms that you feel, whether vaginal itching or otherwise, and again, you may, but the vast majority of cases don't, it's the longer term consequences that particularly impact women. I'm mostly talking about the bacterial, the curables, if you will now, the syphilis, gonorrhea, chlamydia. These are highly linked to infertility, PID, other longer term conditions. So getting them, it's okay if you do contract something, as long as you get it treated. Obviously, the best thing is prevention. You want to prevent as much as possible, but don't be so afraid that you're not willing to go get tested to find out, because then you can get treated.
Yeah. And so all the major medical associations recommend for anybody that's 26 and under that you get checked once a year for chlamydia for women. And if you're a higher risk population, which is adolescent medicine clinic or sexually transmitted infection clinic or juvenile hall, or certainly anybody who's been arrested in your family or in your partnerships, not your family, but in your partnerships, then you should also get checked for gonorrhea. And then once a year for HIV if you're sexually active.
Right. So we talked about herpes earlier. If we just go back to that, like which symptoms should one be on the lookout for?
So with herpes, with HSV2, again, not in all cases, in many cases, you will have no symptoms. When people do have, if you're going to be a person with active outbreaks, oftentimes that first week you may have a fever and you'll have what's called an outbreak. So sores on your genital area. So during this period of time, it is the most important. Do not have intercourse, etc., or oral sex with anyone else, because that is absolutely highly contagious. That's also the best time to actually get tested to know for sure, and by going into a physician. That is in supplement to the antibody test, which can be done through Safely or other labs. But then what you'll want to do in that case is you're assuming that you are positive for HSV2, then your physician will prescribe you an antiviral. So valsarcomil, you've seen the commercials for Valtrex, can be extremely effective to kill. It'll take down that virus, and then you will be much less likely. One, it will reduce the duration and severity of the outbreak, and with continued use, you will be much less likely to ever have outbreaks.
Yes, but again, rarely does a physician prescribe it for continual use. They will generally prescribe it for that initial outbreak. And if you have more than 3 to 5 outbreaks a year, then they would consider suppressive use. But suppressive use is every single day. And there are very few people that I know that are on Valtrex every single day.
Right. So,
and then for herpes, I don't think you ever gave the exact stat, but it's approximately 80% of people with herpes have no clue that they have it. And same thing with 90% of people that have chlamydia have no clue that they have it. And a lot of women with chlamydia only find out when they're trying to get pregnant and they're having a hard time and they run some chlamydia antibodies and they're like, you had chlamydia. And the woman's like, what? And like, we don't know how long ago she had chlamydia. We just know she had chlamydia at some point. It could have been last week. It could have been a month ago. It could have been years ago. And so that's why we recommend the annual screening under the age of 26 at a minimum for your consideration. But again, better to avoid it in the first place by making sure you use a condom. And then just as a feminist, I like to promote condom use. Not for sexually transmitted infection use, because I am a married woman and I carry around a condom bag and people make fun of me. So here's the plug for the condom bag. And they're like, ooh, you're married. Why do you use condoms? And I was like, because I don't like to leak semen for the next 24 hours. So like, I think all of us with uteruses should be like, I'm not going to leak your discharge for the next 24 hours. So unless you leak my discharge out of your butt for the next 24 hours, I'm not taking your discharge. You take your discharge with you, you know?
To each their own on the discharge and semen. And that's what I will say, though, is what we say is use with condoms and common sense. You know, it's your body. Make the decision that's best for you. It's important. Use in conjunction. Getting tested and condom use are great. We also know we live in the real world. I also know that 50% of millennials don't use condoms. So I try to meet people where they're at. So yes, use condoms, particularly if it's not somebody you're in a long-term relationship with. If you are not using condoms despite knowing that, then definitely get tested, but don't do either, because this is your one life. And it's very much, the thing with this, another kind of lesson from COVID is, we learn a lot about contact tracing, about, exponential growth, right? Well, this is sexually transmitted infection. So it's actually a lot harder to get. You have to actually have sex with the person. So, the more that we all kind of work together and get tested frequently, practice safe sex practices, we actually have a good shot at actually reducing this overall. And then what we like to say is make the world a safer and more fun place to be.
I think the key, though, is you can also get it from oral sex, and that it's not limited to penile vaginal sex. You definitely get STIs from anal sex, and you can get HPV from fingering. So that's like the exception strange thing. And then I just saw someone ask, can you get HSV from going to third base? I don't know what third base is. Do you guys know what third base is?
Third base is oral sex. That was in my
okay.
And then all the way is
yeah.
Got it. Okay. So yes, you can absolutely get herpes from and you can get HPV from oral sex. So that's actually a thing. People have been getting oral cancer and it's from oral sex. And I was like, Michael Douglas, good guy doing oral sex on people, so at least he's giving oral sex. I always thought there was a disparity in the genders, that I feel far more of those of us without penises are giving than receiving. And so I love it when I hear equality on that.
Right. You were answering that one. Sorry, I just clicked over. Now I can see where the questions are. Very exciting. I didn't know where you
I saw one question, just to quickly answer it. What's the difference between a wart, W-A-R-T, and a pimple or a zit? And so a pimple or a zit is you have a pore, and it usually leaks out oil, and it often has a hair in it. And if it gets blocked, then pus, which is like white blood cells and nastiness, goes, and then it pops. Whereas a wart is like a pre-cancer, and it's cells growing out of control. And so there is no liquidy pus popping thing. It's like a whole bunch of cells stacked up on top of each other. And a lot of people say it has like a cauliflower appearance. So if you look at it, we call it fungating. It looks like fungus. Or if you look up cauliflower, that's what a wart looks like. But there are also smooth warts too. And then if you're looking in the genital area, what's scary is there's something that looks like warts, but is actually syphilis. And syphilis lesions are crazy infectious. So you do not want to oral sex on a syphilis thing, or else you can actually get syphilis of your tongue. And you don't want to touch a syphilis thing, because you can get syphilis in your eye. You can get gonorrhea in your eye. So like spraying, discharge or, semen, you could get, gonorrhea, chlamydia in your eye. And you can definitely get gonorrhea of the throat from oral sex as well.
Oh, yeah.
So it's important with all of this to take into consideration, who are you? What is your lifestyle? What are your sexual practices? And make decisions based on that. So and I think that's part of the thing that's so difficult for people. People are always asking, how often should I get tested? And, how at risk am I for STDs and all of these kinds of things? And that answer, if you look in the CDC guidelines, they have these big blanket statements because they have to be really worried about everything being right. And then you have to really apply it to, okay, what do people really need to do to actually be safe? So, if you're asking on the public health side, it's somewhere between after every new partner and once a year. Well, that could be a very large range, and depending on how many partners you have, that could be impossible. Yeah. And as Adriana said, it could not make sense because most STIs take some time to show up, a varying amount of time each. Also, you can also get something between each new partner. For our users, we see everything from 2 weeks up to about once a year. And it really does depend. What we recommend is at least once, if you're generally sexually active. So you're not in a monogamous relationship, and or you and your partner are having sex with other people, or you are at least once every 3 months, but for a minimum once every 6 months to be safer. But again, we have quite a few that get tested once every 2 weeks. Also, interestingly, little case study, but we have a partnership with the adult film industry, which has done an amazing job at bringing the rates of STIs, including and very much particularly HIV. They've had like one HIV outbreak in years, and they have a really strict protocol about it. But part of it is they get tested once every 2 weeks, and by doing that, you can catch things in the bud. So if while it does take some time for things to show up, if you're continuing to have sex, it's better to go more frequently, and then and plus there's nothing better than peace of mind. Knowing is knowledge is power.
But again, from the medical perspective, it only reflects for HIV 6 weeks ago. And so if you are really concerned about HIV, then, you need to worry about 6 weeks ago. And if anyone, is in any high risk group, men who have sex with men, recently incarcerated, or doing IV drugs, then those you definitely want to wait 6 weeks. And I tell people, just because someone shows you that they're negative for gonorrhea, chlamydia, doesn't mean that they're negative for herpes, doesn't mean that they're negative for HPV. So if you're having relations with anything with a penis, doesn't mean that you're protected. And so sometimes people won't protect themselves, but they will do something for their future child. And so if your future child goes through your vagina and you have HPV, that baby can get covered with HPV. And the worst possible case is when they get it in their lungs, because they're breathing as they're coming through your vagina into the world, and they just sucked in HPV. And normally you and I, 80% of us will kill the HPV, but 20% of us won't. With a baby, it's a much higher percentage, because it's like, oh, it's from my mommy, it must be my friend. And so it doesn't try to kill it. And so that is a high risk. And then the other one is herpes. Once you get herpes, it is there for life. And if your baby goes through your vaginal canal and you didn't know you had herpes and you were in that negative window when they tested or whatever, then your baby can get covered with herpes, and they can get herpes of the eye, they can get herpes of the brain. And that one is sort of like a pimple. It's a vesicle. It's a liquid filled bubble that happens all over the place, and it pops. And so then your baby will have liquid pimple pop, eye, or liquid pimple pop brain. So if you and your significant other want a perfect baby, which I would think if you're going to make a baby, I want the best baby possible, then it would behoove you not to get HSV and not to get HPV.
So if we look back to having maybe multiple partners, how should one go about talking about STDs before engaging in sex for the first time with a new partner or just someone new?
Absolutely. So this is why we created this app, because from a personal perspective, I always wanted there to be an easier way to have the conversation with the partner and to verify that they have been tested for what and what the results were. And kind of thought it was crazy that the status quo was, have you been tested? Yes, the end. And so kind of missing a lot of information there. So, obviously this is not the only way. I'm not trying to just do a plug, but hey, shameless plug. But I'll talk about different scenarios that either me or other users, other friends kind of have experienced. So how do you meet people? Now it's COVID times. A lot of you are meeting on dating apps. If you're meeting somebody on dating app, I will say disclosure, like if you're meeting someone for the first time and you're having sex with them, please use a condom. Again, use condoms and common sense. I said if you want to have, but that said, condoms don't protect against everything. You should definitely always get tested and know that they have. So the question is, how do you bring it up? That depends on you. So a lot of people I know will do it before the first meeting. That can seem too forward, I understand, but there's ways that you can do it that don't. I like the app thing because it can be kind of cheeky. Like, by the way, have you seen this cool app? Like, haha, hint, hint, I have this, you probably should too. Not saying that it's a given, but if you want any hopes of it, you're going to want to make sure you're good to go here. The other time is sometimes it'll be that moment that you think it's might going to happen, and then you can kind of ask it. The beauty of it is it can always be there. And if there's sometimes, people come to me and they're worried that there might be pushback, or, there can be the fear of being called a slut or something like that. And I'm not using that word in any sort of a way, except for let's reclaim it kind of a way. What I say to them is this: if someone isn't willing to be transparent with you about their sexual health status, then why risk it? Because this is something that, if you are going to be intimate with this person and they have not been honest with you, then that's something that's for life. It's done in a way, though, and I think when you really kind of own it, the more you own it and the more you really feel that this is something that you are empowered to do. You are a strong, empowered woman and or man, and being able to have that confidence to say, this is something that's important to me. I take my sexual health very carefully. This is not any kind of a comment on how often I sleep with other people, etc. It's just, this is my standard protocol. And if you are not into this standard protocol, then you are not at my level. So that's kind of the basics. It's never not going to be at all awkward, and sex is never going to not be at all awkward. But the goal is, let's make it a little bit less awkward, and let's just own it. And just like with sex, you can lean into the awkward and feel weird about it, or you can say, hey, like, I'm owning my body, I'm owning this experience, and have fun. So have fun, but do it safely.
Because STDs is universal. Everyone can get it. So there's no need for it to be stigmatized or you need to be embarrassed. And if you want to take care of your body and your partner's body, you might as well just get it over. We'll talk about it, get it up in the air. And that might start a domino effect that that your friends might start doing it. And then, everyone will start being more open about it.
Exactly. It's about creating this new normal. Like, duh, what do you mean you don't have this? What do you mean you haven't been tested? You're not willing to be honest about it. You're willing to put your penis in me, but we can't have this conversation. So yeah, absolutely. I know. I was going to say something.
Exactly. So when you stop using the condom and you want to talk about babies with your partner, when do you think, or like how do you think that one should start that conversation? How do you get that going?
The question about when to have babies?
Yes.
That's probably more of a question for you. I mean, I can answer it, but
I think it obviously depends on every relationship. And, ideally it would be a long-term relationship with a commitment to raise the baby together, because 2 is better than 1, and more money that you can get together to help grow the thing to the best of your ability, the better it is. So I think it's important, hopefully, that it's a decision on both the sides and that it's not a unilateral decision one way or the other. There have been cases of contraceptive sabotage by a significant other, either not allowing a woman to use her birth control or using a condom and poking holes in it. But generally, I think that if a person with a uterus and ovaries wants to get pregnant, then they should discuss it with the other person, or else they're taking sperm and doing stuff with it that, that the other person doesn't know. And I think it takes 2 to make a baby. And so it should definitely be a discussion amongst the 2.
Is there a specific time that they should do it? They should start talking about it? The question goes, when should I talk about having babies with my partner?
I think 9 months before you want to have a baby, and before you start considering having a baby, you should take multivitamins, possibly for 6 months, maybe ideally a year, so that you can make sure the nutrients are maximized, so that what you create has the maximum nutrients and doesn't have any defects because it's missing some of the nutrients. One of the most important being folate. And then the other thing about in terms of discussion in respect to the app is that you might want to check on your herpes type 2. And if the woman has herpes type 2, then a consideration might be a C-section, or at least suppressive medications when she gives birth, such that the baby doesn't get covered with herpes 2. And then you'd want to check the person with a penis as well, because if he has herpes 2 and she doesn't, then during the whole pregnancy, you want to use a condom. So when she gets pregnant, and that's the risk of her catching herpes at the pregnancy, Then after that, you want to prevent it. And they've shown the ability to prevent it if the guy uses the condoms, obviously, but also can take suppressive medication. So you could ask for that.
Right. And another common question that we have received is, does birth control protect me against any STDs?
No.
Yeah, so the only birth control that protects against STIs is the condom, right? And but hormonal or non-hormonal, any other method except for condoms. And then we always like to throw in abstinence and masturbation. That's a contraception too, if you do that instead. Then those are the only things that protect against sexually transmitted infections.
Exactly. So, want to protect against STDs, get those condoms. So,
and then know that there's different thickness condoms. So that's the thing I think people need to know is I don't get paid by this company, but I plug them all the time, condomdepot.com. They have ratings. He said, she said, he gave it like an A-, she gave it an A+. And so at our clinic at Stanford, we pride ourselves on having the top 3 condoms because I feel if you start with a good condom, then you're more likely to use it. If you use a crappy condom and you're like, this is horrible, I can't feel anything, then you don't want anything. And you also don't want a dangerous condom. So you want a condom that's been tested and even though it's thinner, not going to blow up or pop. And you absolutely need to know how to put it on properly, ideally with a reservoir tip, not inflated, so that when the semen does go, it doesn't blow the balloon. It instead, stays within the semen. But know that there are different thickness condoms. Know that there are different textured condoms. Know that there are ones that help the person with the penis last longer. And the fun fact that I want to put out there is basically it's numbing medicine. It numbs the penis so that the penis can last longer. Because a lot of guys, they get in there, they're done. And then the person with the uterus doesn't get her orgasm. In any heterosexual encounter, 30% of the women do not have an orgasm. And I find that sad because if you're not getting your orgasm, you need to better communicate with your partner or your partner needs to work on it such that you get yours.
There are also condoms with taste. I have heard about bacon condoms and strawberry condoms. I am not sure what the purpose is yet.
Oral sex. It's for oral sex. It's not for vaginal sex. You don't want
it to smell good
fruit-flavored vagina.
Condom in your vagina.
Yes. Don't put a flavored condom in your vagina. Your vagina might not react well. It might get bacterial vaginosis because it's a foreign body with extra flavoring.
Great. So they're meant for oral sex to protect for example,
herpes.
Herpes, yep. Exactly. So
and to protect you from HPV.
That too. So are there any questions that in the comments that you would like to answer, or because I think we are running out of time?
I think a key question is, can any of these tests be done online? And I think the answer, you can get it online, but you have to sample the body. And so either you have to go to a lab and submit the sample or do the sample there, or you can do it at home and then send it in. So maybe, Lauren, you want to cover what kind of samples and how you guys do it.
Yeah, so you can book an appointment and go into the lab. So the appointment is done on your phone in lab. And then we are adding at-home testing. There's also other at-home testing available. So for that, they'll mail you a kit. Then so it's at-home collection, right? So it's done on a dry blood spot. So you'll do a little finger prick. They give you instructions, depending on which one you use, or maybe you may have a little telemedicine. So your doctor kind of there overseeing it. Pee in a cup, swab, and then you put it in with you following the instructions, put it in a little kit, mail it off, and then you'll get the results. So there's no, you cannot use your phone to do the actual testing now. You can use your phone to help visually diagnose certain things, but not to any sort of great extent. So, but you can use your phone to get those tests and get the results.
Great. I think that's a great final sentence to end off on. So I want to thank you, Lauren, for joining us today, and Dr. Yen for your time again. And I also just want to remind everyone, don't forget to use the code SAFELY with Pandia Health for $5 off your online doctor's consult. And also use the same code SAFELY for $10 off your STD panel with safely.me. You can see it all down there. So that was great. Thank you, guys.
Thank you.
Bye.